Good afternoon, everyone. First of all, I would like to thank the organizing committee for giving me an opportunity to participate in this FDP program on effective ways to develop e-content for teaching and learning. Uh, as you can see, the today's situation is more towards this COVID-19. So I took this opportunity to speak little bit about this COVID-19. So in this lecture, as a part of assignment, you will come to know about this COVID-19. I will give you the brief introduction. What is COVID-19? What's the world situation today? And what's the India's situation today? And how to prevent it. So getting into the introduction, the COVID-19 name is originated from coronavirus disease, and 19 is specifically for the year 2019 when it was first started. So corona in Latin means crown or halo. Uh, it comes because as you can see the SEM images from the scanning electron microscopic images, where you can see the small crown like structure on the top of these viruses. So due to this corona name originated. The origin of COVID-19 is said to be started from this Wuhan city of China. Wuhan city is located near to west part of this Shanghai. As you know, all Shanghai is most popular, and south of the Beijing. This disease is actually a highly infectious disease and spreading among the people across the countries. Therefore, World Health Organization, who has announced this, it is as a pandemic because it is spreading over all the countries, and within the countries it is going with, I mean, people to people are getting infected. So basically how it spreads and what are its symptoms, you can say that it is basically goes through the coughs, or when you sneeze, the droplets which are coming out of your mouth or nose, they they contain this virus. And if a normal person is in contact, is in close boundary of this coughing person or sneezing person, then this droplet can settle on his hand or body, and then this normal person can get affected. It can also become, if you come in contact, so close contact with the personal contact, you can say, then the normal person can get infected. If you have a contaminated object, a diseased person or infectious person have touched this object, and then again a normal person gets, so this object gets contaminated and a normal person touches this object, then you have an infection. So it can also happen mostly in the mass gathering, so one or two persons are infected, and when they are talking or sneezing or coughing, in that case this infection can spread from one person to other person. So what are the common symptoms? Once you get infected, you feel have a dry cough in the initial days, then you have high fever, sour throat, and difficulty in breathing. So high fever and difficulty in breathing are the most serious situation. In that case you need special attention and need to see a doctor immediately. So looking at today's world situation, if you see, it started from the Wuhan city near to the Beijing, south of Beijing, and then it spread all over the world. You can see how densely it has covered the whole countries of the world. Almost 216 countries have been infected, and among them almost 49,93,470 people have been confirmed for this disease, and there you can see 3,27,738 people have been diseased or died because of this pandemic case. So looking among these all countries, again United States, the most, I mean, powerful country in the world, has seen the most tragic situation. So almost 16 lakh people have been infected in this country, and around 1 lakh people have died. Our India is somewhere on the 10th place. Almost 1,20,000 people have been infected, and 4,000, around 3,500 people have died. So if you see the India's case states, within India, there are many states which are above 10,000 figure, and the most affected state is Maharashtra, where 41,000 so far have been infected. Though this is good for us, we hope that this do not grow above this. Around 1.5 k people have diseased because of this pandemic situation. So how to control it? The best way to control it or to prevent it is wash your hands very regularly, because if you touch a contaminated object, or by chance you come in contact with the infectious person, then this infection can carry through your hands, and you carry the infection. So it's better to wash your hands properly, wear a mask always, keep safe distance, avoid contact with the sick people. Always, if you have a cough or a sneezing problem, then cover your mouth, and then wash your hands regularly. With this, I would like to say that we hope that we come to this situation where we have people without mask and roaming here and there uh, freely as before. And with that, I would like to thank. I hope you understand what I have said in this 5 minutes audio video lecture. So this was my first audio video lecture, and hope you understand what I said. Thank you very much. Thank you very much for your attention.